Hi, Dave with Align Therapy. I want to talk about the way that scoliosis is treated in the US and why that probably needs to change. And this doesn't blanket all providers or all physicians or all therapists, but the way that we treat scoliosis in the US and probably some other countries too, but specifically the US needs to change. It's changing, which is good. So if we look back about 20 years, scoliosis wasn't really treated. It was just the watch and see if it gets worse approach until they need surgery. There was the Milwaukee brace that came on. I don't even remember what year that was, but bracing has changed. But bracing has become more adopted in treating scoliosis. But the thing that hasn't been adopted very well, and the thing that's near and dear to my heart, is scoliosis-specific exercise, which is like the Schroth Method and the C's approach and the Lion Method, and there are some other methods associated with scoliosis-specific exercise. Now we'll see it termed PSSE, Physiotherapeutic Scoliosis-Specific Exercise. So if I use that term, that's what I'm talking about. So historically in the U.S., we've kind of gone off and on with bracing. Right now we're kind of back on with bracing, but it's not something that is it's not something that's been consistently done. So just to give you a range of scoliosis, so mild scoliosis, hopefully you can see this, mild scoliosis is 10 degrees to 25 degrees. So less than 10 degrees, we don't even call it scoliosis. But 10 degrees to 25 is mild scoliosis. Then we get into moderate scoliosis, and that is 26 degrees to about 45 degrees. So this is where we tend to think of bracing. And then we have severe scoliosis, that's let's see, 46 degrees, that's a 4 and a 6, and above to whatever. So 46 and above is severe scoliosis. So we classify treatment differently in each of these categories. So historically, in mild scoliosis, we don't do anything. We just watch and wait until it gets worse, and we see if it's getting worse. In moderate scoliosis, this is the bracing category. This is where daytime bracing has historically been used. Severe curves, that's when surgery comes into play. So 46 and above, we start to think about surgical intervention to stop progression of the curve. So we've talked about bracing and we've talked about surgery, but in the US we really don't talk as much about PSSE, or scoliosis-specific exercise. Where do we put that? Where do we start using that as part of treatment? I've heard some people say that PSSE goes in the mild category, and this, once it gets above mild, then we just brace. And I've heard that once it gets above 46 or 45, that nothing can really be done scoliosis-specific exercise-wise. In my opinion, I am a little biased, but I think PSSE should be in each of these categories to stop progression, to increase strength, to build body awareness. If someone is in a brace, then they usually have weakened core muscles and less body awareness because they've been in the brace. PSSE is a great way to increase body awareness and increase strength and maintain that strength while they're braced. Even patients who are looking at having surgery, why not do something that has been shown to be effective in reducing progression of the curve while they wait for surgery? Or recently there was a study of patients who refused surgery that had 40 to 60 degree curves, and it was still effective in doing PSSE with them to stop progression of the curve. So why not use that in the severe category as well? Mild category, if we're just waiting to see if it gets worse, why not do something proactive about it? And why not do something that can stop this curve from progressing to where it's moderate, so that we don't need to brace and we don't need to look at surgery? So in the US, we're getting more scoliosis-specific exercise providers, which is fantastic. In your state, there's definitely someone who does the Schroth Method. And we should be utilizing that in different stages. I've met with a lot of surgeons, I've met with a lot of other scoliosis professionals, and sometimes it's hard for everyone to get on board with this, but really there's no drawback to scoliosis specific exercise. It's only helpful. It's helpful in stopping progression of the curve, it strengthens, it gets more mobility. There's no real drawback, so why not plug it in to each of these categories? A 10-degree curve, we might not need PSSE. A 56-degree curve that's having surgery next week, maybe we don't start PSSE right off the bat, but I think there's a huge place for this. We see benefits here in the clinic all the time, and again, there's no drawback to it. Bracing, there's definitely some drawbacks to bracing. Surgery, there's definitely some drawbacks to surgery. But why not do something that's beneficial and has been researched and shown to be effective? So check out on our website, we have some information on research that backs what we do for scoliosis specific exercise. Check that out and see that it is supported in the literature. And also look at some of the videos on what we do as far as PSSE goes. If you have scoliosis or you know someone that does, share the video with them, subscribe to the channel to learn more about other things that we do and how we treat this and some of my other soapboxes. And hopefully this video is helpful, and we'll see you next time.